Hello, everyone. Hello, you're welcome on today's program to the 56th edition of Your Health Matters program. My name remains Labake, also known as Elizabeth, the anchor of Your Health Matters program. Today, I got a special guest who's been on the program before. He's a GP. Please join me to welcome Dr. Adetola Oshinubi. You're welcome on today's program, please.
Thank you. Such a great privilege to be here again. Thank you and well done for all your good work.
Thank you. So just for the benefits of people who are actually seeing our guest speaker for the first time, can you please do a bit of introduction, clinical background before we kick off? Thank you.
Oh, okay. My name is Dr. Adetola Oshinubi. I'm a GP in the UK. I've been working as a GP in the UK for a while now, and I also practiced in Nigeria before I relocated to the UK.
Thank you. So, like I said, today's program is actually a raining day. I don't know if it's actually raining in your area. So it's actually raining here in Barking. So the topic before us is actually blood pressure. In the past, we've treated blood pressure, but I think it's actually like a rampant, ongoing issue, and we've been told and asked to bring it back on the program. So, Dr. Adetola, when we say blood pressure, what do we mean?
Oh yeah, like you said, blood pressure is a common thing, and quite often people when they talk about blood pressure, really, they are most of the time they are referring to high blood pressure, which is also called hypertension, and which means that, of course, the blood pressure in itself is the force of the blood pushing against the walls of our blood vessels. And that's essentially what blood pressure means. And of course, so many factors can then affect it to make it high or low. Like I said earlier, the common one that people usually talk about more is hypertension, which is high blood pressure. And to be able to say somebody has a high blood pressure, really, we look at two figures. So if you have a BP machine, also called sphygmanometer, it does your blood pressure and gives you two figures. One is called the systolic blood pressure, which is the upper part, and the lower part is called your diastolic blood pressure, which is the lower part. In lay terms, the systolic blood pressure is just the pressure at which your heart is working. That's in lay terms. And then the diastolic blood pressure is the pressure at which your heart is resting in lay terms. Of course, we can go into deep conversation about what that means, but I think in lay terms, I'll just leave it as that. But for you to be hypertensive or to have high blood pressure, then the upper part is going to be more than 140 millimeter of mercury, and then the lower part will be more than 90 millimeter of mercury. So anything above that is what we call high blood pressure. The other one, which is the other part of the blood pressure, is the low blood pressure, which again is not that common. Again, we can go into what do cause it, but in terms of the figures that count as low blood pressure is anything. So the upper part, which is the systolic blood pressure, if that's lower than 90 millimeter of mercury, and then the lower part, which is the diastolic blood pressure, if that's lower than 60 millimeter of mercury, then we say the person has a low blood pressure.
Thank you. And I think you're very right, because at the mention of blood pressure, people tend to focus too much on high blood pressure. And like you rightly said, few people, experience the hypotension, which is the low blood pressure. Thank you so much. So for me, I think the next question will be, what are the causes of high blood pressure?
Yeah, that's a very good question. High blood pressure, like I said, is quite common. At some point I'll tell you the statistics around it to tell you how common it is, but it's quite common, especially among black people. And unfortunately, with high blood pressure, quite often you don't have any symptoms until you then start having complications from it. That's when you then know that you've had high blood pressure. Quite often as well, most of it, there are no known causes. But we also know that genetics plays a part in it. So it can be
Mm,
passed from your parents to kids as well. So we know genetics play a part in it. We know that your diet plays a part in it. So at some point, I'm sure later in the conversation, we will talk about how we can prevent it. So diet, for example, if you eat diet that is high in salt,
mm,
processed food, fried food, especially us from the African background, we want to spice our food, put too much salt, push too much Maggi, and all those things. Research has found out that it can predispose you to high blood pressure. The other things that can predispose you to high blood pressure is lack of exercise. So if you are sedentary, you're not exercising enough, you can predispose you to high blood pressure. Stress
mm,
can also do that. So if you're stressed, you're not resting enough, you are predisposed to that. Alcohol, smoking, are also some of the things that can lead to high blood pressure as well. Um, Kidney disease
mm.
is also one that can lead to high blood pressure and yeah, again, that's one of the things that would not even show, or
Mm.
you will not even know that you have any of those until you start having complications.
Wow.
So in a nutshell, those are some of the several factors that can lead to high blood pressure. But that list is not exhaustive,
Mm.
but those are the common ones.
Thank you. I think I kind of like the way you kind of broke it down. Um, a little bit, let's deviate a little bit. Recently on the social media, there was this influencer that passed away, and I think she's from Nigeria.
Mm,
And this individual used to be on the bigger side,
mm,
you know, and she happens to be a victim of people actually, I wouldn't say bullying her, you
mm.
understand, because bullying is actually a kind of, they kind of body shame her,
Okay.
they kind of body shame her, whatever she puts on, whether loose, whether tight, people always have opinion
Mm,
on it is actually, go on diets, go on exercise. And we didn't know what this individual was going through, which people, they're not sensitive when passing their opinion on the social media. Some people can come a bit abrupt and too blunt. And some people come from the perspective of hatred, and they just dish out whatever they have in mind on other people's life. So this individual actually, according to the information, she passed away. I'm talking of last month. This individual influencer passed away, and causes was she was actually she had too low blood pressure
mm,
in the process of trying to lose weight. So now we're talking about the causes of high blood pressure, and
mm,
which I know this is where majority of people focus on high blood pressure. But there
mm,
are some individuals, especially the individual that actually require that we treat this topic. It's somebody who is actually on the bigger side, which actually trying to lose weight. And at the end of the day, the GP has told her she needs to stop because I think her blood pressure is dropped. So can we talk a bit about, because I don't understand, how can somebody die of hypotension? That's
mm.
low blood pressure, isn't it?
Yeah, yeah,
So
yeah.
I'm trying to understand the link between excessive weight loss and hypotension.
Yeah, thank you for that question. And I just want to use this opportunity as well to wish the family of the social media influencer that lost her life recently, supposedly due to a low blood pressure. I'm not sure exactly how they came about the low blood pressure as the cause of the of her death, but again, that's not the topic for discussion today. But low blood pressure, like I mentioned earlier, is when the upper number is less than 90 and the lower number is less than 60. Quite often, the commonest cause of it is dehydration,
Mm,
um, blood loss. So, for
mm,
example, if you were losing blood, for example, you have internal bleeding. So people who
mm-hmm,
have
mm-hmm,
who have
mm-hmm,
accidents or for whatever reason they are losing blood, either internally or externally, and so they lose blood.
mm-hmm,
At some point, they when they keep losing blood, because the volume of blood they have in their blood circulation is low, so
mm,
they don't have enough blood to pump out, and
mm,
that then leads to the low blood pressure. And for it to then be able to lead to death, then it means that they've gotten to a point where we call circulatory shock
mm,
or hypovolemic shock, which means that the organs in their body, for example, their brain, their kidneys, their heart, is not getting enough blood supply to function.
mm, mm,
So that's the downside of hypotension. Although it's not common, but
mm,
we know that it can happen. The other thing that can cause hypotension is, for example, you were previously known to be hypertensive. You
mm,
are now on medication. So perhaps the medication you are being given is overcorrecting your
mm,
blood pressure. And then that can then lead to hypotension, especially, for example, perhaps maybe when you were on that medication, you were obese, you were very big, and then you are also now losing weight in addition to using the medication. You might get to a point that your blood pressure will have reduced because you're
regulated.
losing
Mm,
weight.
mm,
And then if you are now still on the dose of medication that you were previously using when you were still obese or overweight, there could be a discrepancy
mm,
in how the medication is working. So the medication can now be overcorrecting your blood pressure, and then that can then make you have low blood pressure. But quite often, people that have low blood pressure, they will have so sometimes that's the good side of the low blood pressure, because sometimes when your blood pressure drops below that threshold, you start having symptoms really. So for example, start feeling dizzy,
mm,
you start feeling dizzy, you are lightheaded, you start having headaches, and you start feeling generally weak. And so
mm,
that might then be a pointer to have your
mm,
blood pressure checked just to be sure that it's not low, it's not too low, or
mm,
perhaps if you've been on medication before and you're also losing weight and doing some lifestyle modifications, just to be
mm,
sure that there isn't a need to titrate your blood pressure medication, or perhaps to even stop it because you
mm,
probably don't need
mm,
it any
mm,
longer.
anymore. Mm.
Yeah, so those are some of the intricacies that can surround a scenario like that.
Thank you. I think you're very right because I remember when I read the write-up, it wasn't just hypotension, it was actually internal bleeding. You
Okay,
understand? But obviously the whole scenario was as a result of she was losing weight. You
okay.
understand? So I don't know, they didn't come out in details in
Mm,
terms of is there any other underlying physical health that we're
yeah.
not aware of. So I think the message I'm trying to pass on is on that aspect why I said let's deviate a little bit is that it's okay for people to tell you to lose weight, but in the course of doing it, make sure you actually know your body. Because individuals have what do you normally call it? Like for me, my normal blood pressure is 130 something. Of the systolic is always 130 something, and the diastolic is always 60. So for
Mm,
me, if I'm going above 70, 80, I know I need to cool off. I need to slow down. You understand? Which
mm,
is still normal for the other people. People need
mm,
to know their body mass. You understand?
mm,
And
mm,
then know what is the accurate or what is right for
mm,
them. And I think you made a very valid point, which I need our audience to focus on. If you're on blood pressure medication, because I've seen some patients that they've said they've been on it for 20 years without any
mm,
medical review.
mm,
You understand? You need to go and see your GP to ask for a medical review to know whether you understand you still need it, whether the dosage needs to reduce, whether
Yeah.
it needs to increase. So you don't just carry it on
Yeah.
forever. Thank you
Yeah.
so much. So you mentioned about talking about the statistics. Can we go into that?
Yeah, so the statistics of blood pressure, I will just give a brief statistics about blood pressure. So this is based on NHS findings. So it says that high blood pressure affects at least 1 in 4 adults in the UK. So that
Wow.
means about 25% of adults in the UK will have high blood pressure. Like I said, it is quite common. And it says that, for example, in England, 9% of adults between the age of 16 and 44 have high blood pressure, while 60% of adults over the age of 65 and over do have high blood pressure. So again, we know that as we age, as we increase in age, the risk of you having high blood pressure is quite high. So and that's why again towards the end I will advocate that after the age of 40, make sure that annually, if it's possible, to get your blood pressure checked and to get yourself checked, just so that all those things can be picked up in time and nipped in the bud if one was picked up earlier.
Thank you. That's actually a very good information, and that's a bit scary. People age 16 having
Yeah.
high blood pressure.
Yeah.
When we're growing up, it used to be all these things used to be disease of the rich
Yeah.
people. You understand? Because at the end of the day, can we actually then talk a bit about our diets, especially when you mentioned that high blood pressure is actually rampant within the Black minority?
Yeah. Yeah. Again, I sort of like made a comment about it earlier on because again because of the kind of diets that we're used to,
Mm,
including me as well. We want to eat good food. We want to eat our pounded yam and foile meje and all of that, and we get to spice it a lot.
mm,
So salt, we know, increases your risk of high blood pressure. And sometimes if we eat, we will sometimes eat like there is no tomorrow sometimes.
mm,
And we overeat. And quite often when we do that, all we want to do is to just sleep
mm,
because
mm,
we have overfed ourselves. And if we keep doing that, then you won't have enough time to say, oh, I need to exercise. So number one, because you are eating too much,
mm,
all you just want to do is sleep. And
mm,
because you are not using the meal that you've had, that will add to your weight. Number two, because you have also eaten too much, you are not exercising, and the
mm,
lack of exercise also predisposes you to high blood pressure. Number three is the fact that because we spice our food too much, with salts and curry and Maggi and all of all those things too, research has found that it can be linked as one of the risk factors for developing high blood pressure.
Thank you. I think I got on one psychiatric on the program a couple of months ago, and Dr. Ogunsheye was saying during the program that when we go to African party, some people they put everything in one place, like somebody wants to commit suicide. And at the end of the day, knowing fully well that the way the season party food is even extra
Yeah.
compared to the one we cook at home. And I think
Mm,
the message we need to pick in there is that, which I've been advocating to all my elderly patients, families, and friends, especially we Nigerians that live in Nigeria. Because if you look at this calculation, people get into their car, majority of people, an average Nigerian has a car. You understand? I'm
mm,
not talking about people that go, because barely will you see people who are actually going on public transport because they work. Some people don't even have money for transport. So they do
mm,
exercise, not because they want to exercise, because there's no financial means for them. Some people have
mm,
to trek half mile, which is even healthier because in the course of walking, they're doing exercise. But for the average comfortable Nigerian who has a car, they wake up in the morning, they get into the car, they get stuck in traffic for an hour and 30 minutes, they get to the office where there's AC, they sit from morning to evening, they come back home, some of them get home 8 or 9 o'clock, they have this delicacy, like you said, pounded yam, some of them has rice. So if all our food actually are carbohydrates, majority of our food,
Mm.
rice, pounded yam, yam flour, even it took me a very long time before I can know that even beans is not full protein. Our beans is not full protein. If you really want full protein, you need to be eating kidney beans. Our Nigerian beans is not real full protein, according to research that I actually read. So at the end of the day, people tends to eat 8 o'clock or 9 o'clock, some 10 p.m. and they just go to bed. And weekend, they visit families. Some have religions, commitments, over the weekend. So they barely have time to exercise. So what is actually, when you were in Nigeria, and I'm very sure you must have come across one or two people, because I tried to like look for treatment plan that's soothing for people in Nigeria, then talk about the treatment plan for people in UK or in diaspora.
Oh, okay. Again, I think you've mentioned things that are peculiar with our Nigerian population, unfortunately. Because of the economic climate, you have to leave very early to go to work, come back very late. You have little or no time to focus on your health. But I think that one word is paramount is that health is wealth. If you
Mm,
don't maintain your health, all those hustling that you're doing, all those work you're doing is not going to be sustainable. So
mm,
you have to prioritize your health. And they are things that you can incorporate into your day-to-day activities, really. So for example, if you know that you are going to work and you are going to be, for example, entering the public transport, if there is a way to drop off maybe a bus stop before your final destination, your usual bus stop for your final destination, such that you can perhaps maybe have 30 minutes walk in a day, then
mm,
that's advisable. So instead of dropping at your final destination that probably will land you in front of your office, you could decide to drop off a bus stop before then and then walk to your office. That will count. So ideally, we advise that you do a 30 minutes moderate exercise a day. And when I say moderate exercise, is exercise that you're doing such that when you're talking, you're not able to catch your breath. So
mm,
that's what we advise, really. But again, I know people's situation differ, but if you can incorporate it into your daily activities, then that would be something to do. But if it's to when you get out of bed, if you wake up in time, get out of bed, do some home exercises before going to work, that will also be a good one. If you are in office, instead of sitting on your table for throughout the day, get up, walk around, even if it is 10 minutes after every 3 or 4 hours, it will count. It's different
mhm,
from if you are sat down and doing nothing. And of course, we've spoken about diets and how we need to make deliberate efforts to ensure that we reduce salt and reduce the quantity we are eating. um, so I'll give an example. For example, because we tend to eat swallow,
mm.
what what your body actually needs, for example, swallow, is the estimate of what your body needs is the size of your fist.
This one.
Yeah,
That's one wrap of um yam flour or
yeah,
pounded yam or
yeah,
eba.
yeah.
When
That
some
that,
people
that
will go to for almost 4 or 5.
exactly. Yeah. So that's actually what your body needs. Instead of having to eat 5 wraps of fufu or all of all those things, really. So if you are able to be disciplined, really,
Mm,
it will help. So again, the other thing I would say is excessive alcohol intake, especially you go to party over the
mm,
weekend,
mm,
and because most of it is free of charge there, and you just want to drink yourself to stupor. Again, the recommended is is 14 units in a week, which again is advisable to spread that during the course of the week, not that you go to party and you drink everything in one go, really. Of course, smoking as well. We've spoken about that. In fact, smoking does a lot of damage to you. So it's not only about high blood pressure. Smoking is a risk factor to a lot of things. Quite commonly, smoking is one of the risk factors to cancers. So it's not only about blood pressure. Smoking can affect almost all kind of cancers, really. Yeah, if we go into smoking, I'm sure we won't leave here today, because smoking is something entirely, and unfortunately, it's not only the people that are smoking that are exposed to the risk factors from smoking. Even people that live with them, people that are exposed to the smoke, like passive smokers, they are called passive smokers. They are also at risk of developing complications from this as well. So, but I think exercise is important, dietary modification is important, smoking, alcohol, if you're overweight, try and lose weight. And of course, I mentioned from the age of 40, make sure you get annual checkups if it were possible, just to check your blood pressure, check it. And the other thing that I haven't mentioned is that quite often, um, high blood pressure tends to go hand in hand with diabetes as well. So it's something that needs to be. So when you go for your checkup, make sure you're checking for your blood pressure, checking for your diabetes as well, just to be sure that that's not a problem. And I wanted to mention that quite commonly now, most people, especially young people, less than 40, that have high blood pressure, one of the common factor of it is kidney disease. Kidney disease. That's why quite often you see people soliciting for help to help this person, young person that has what we call chronic kidney disease, for dialysis or kidney transplant and all of that. Some of all these things are hereditary, and some of them are due to our lifestyle, really. So as much as possible, if you can control your lifestyle, then you are at reduced risk or reduced risk of getting all these things.
Thank you so much. And I think because of the topic is actually this is not a topic that is for a male or female, it's actually for every individual.
Absolutely.
So, and I think the points that the doctor is telling us is actually the portion of the food we eat. You know, it's actually about the quantity, the portion at which we take this intake. To be honest, you know, I've seen people that at the end of the day, they've come to the extreme end whereby they're not allowed to eat salt at all in their cooking at all. It's not like it gets to a stage whereby you will not be allowed at all, because at any attempt you make, you know, at the end of the day, you're actually killing the organs in your body. So I think we need to be conscious and take our diets very, very serious. You know, the other day somebody was doing an analysis of the quantity of sugar in just one can of Coke. So there was this analysis somebody, a researcher, was doing in terms of how many spoon and the teaspoon of sugar in one can of Coke. And henceforth, I barely have all this fizz, except there's nothing else around, except there's no water, you know. So we need to be actually conscious. I'm going to open the line now. So this is actually the opportunity for you to call in, ask question, please ask question. We've got the GP online. Ask question about your blood pressure, whether whether you know diabetes. It is actually, you don't have to mention your name. We treat everybody's matters confidential. Just call in and ask the question. The number to call is 073 8040 3268. Can we put, because last program we missed the number up. We've actually changed the studio number, but I didn't realize that that wasn't actually the number we had on. So we got the studio number 07380433268. You can actually call in at any time and ask Dr. Shinobi any question. Feel free, whether you have the blood pressure, whether you have traces, whether it's, you're already on medication, feel free to call in and ask the question. So in terms of for people who already have high blood pressure, you understand, and they're actually on medication, is there any chances of being corrected that they can come off the medication? So we'll take the call as we go, then we'll carry on. Hello? Hello? Oh, we missed the caller. Please call back. The number is 073 80433268. Please, okay. Hello?
Hello?
Hello, you're welcome on today's program.
Yeah, good evening.
Good evening.
Am I on the show now?
Yes, please, we can hear you.
Okay. So I want to ask you, can I go ahead?
Yes, please. I think you have another phone. Reduce that phone.
Oh, okay.
So there's another phone where you are.
Okay,
So
I'll be using.
Thank you.
So I just want to ask the doctor, I don't know, will I say I have a high blood pressure? Because sometimes when I'm trying to check my blood pressure in the morning, it can give me like 100 and something or 120 over 80 or normal. Then in the evening, if I check it, it's something else. It can be 140, can be 130. And it's not that I'm actually doing anything stressful or doing any exercise. I might just be at home throughout the day and give me different
readings.
Figure. So I don't really know what happened. Will I say I have a high blood pressure or what? Because I have not been diagnosed that I have high blood pressure, even though my mom has it. But I'm close to 60, so I'm scared of not that I have high blood pressure or something. So I really don't get why I'm having different figure every time I do it.
Okay. Yeah, thank you for that good question. It's a question that I've had to answer for quite a number of patients. So one thing we will understand is that during the course of the day, our blood pressure is going to vary because of various things. When you first wake up, you are well rested. There's an hormone we call cortisol, which is an hormone called stress hormone, really. Even though you are well rested, you're not doing anything. As long as you've been awake and you're doing, even though it's a very, very, very low risk stuff that you're doing at home, that hormone will be released and it can affect your blood pressure. So usually the way to go about it, so except if your blood pressure is just very high, if your blood pressure is around that borderline 140, 130, what we usually advise is that do it in the morning and then do it at night and do it over a course of a week and then calculate the average.
Okay.
So if you do it in the morning and night, so twice a day, and do it over 7 days and calculate the average that you get, it's a better indication of your blood pressure rather than a one-off reading.
Okay. Okay, I'll try that. I think I've done it sometimes years back, and I took it back because my GP advised me to do that. So he said I was fine. But now I'm getting different figures again. That's why I'm worried.
Yes.
And
so
I'm not sure if I'm actually I'm going to resort to a high blood pressure.
High blood pressure or not. Yeah, so try and do the own blood pressure measurement for that week and then calculate the average. That will be a better indication of what your blood pressure is really. Okay. And then okay.
Thank you so much for calling. Thank you. So I think which is actually very good. Thank you, caller, for that question. So for other people listening, so I think let me understand what Dr. Oshinobi just said. So Monday to Sunday, she will do the morning and evening. Then she will add up all the systolic.
Yep.
The top together.
Yep.
Then divide by 7.
Yep.
Then add all the diastolic together, divide by 7, then get the accurate reading. So in case you're still online caller, so you do the reading morning and evening, then you write it from Monday to Sunday, Then you take the top bit, which we call the systolic, you add it together, you divide it by 7. You add the bottom line, which we call the diastolic, and add it, divide it by 7. We pick the next call. Hello, you're welcome on today's program.
Hello, good afternoon.
Hello, good afternoon. Good evening.
You're doing a great show. Well done.
Thank you. Thank you so much.
I just have a quick question to ask the doctor.
Go ahead,
I've
please.
got a friend. She just relocated to this country not quite long.
Okay.
She's got high blood pressure, and the doctor in there, because when she came in, she came with her medicine and everything. So the doctor in there said to her that this tablet, take it off, don't use this anymore. This one, don't use it anymore. This one, continue with it. And after the assessment being done on her, the doctor prescribed some new medication to her to be using. So of recent, somebody was coming from Nigeria, and those tablets that the doctor in here said to her not to use anymore, she actually ordered for those again, and she's still using it. I just want to be sure, what is the difference in those things? Is the doctor in here not good enough, or why is she still going back using the old medicine?
Okay, thank you for that question. Again, of course, there are different medications to manage blood pressure, and some of them are easily available here, or they are within what we call our formulary. So our formulary is like in lay terms our Bible or guidance of what we use in prescribing medication here. So some of them you can easily see them in the UK, is readily available, and some of them they are not readily available. Again, some of those medications, because there are newer model or there are better ones, the old ones will phase them out. So again, in these your friend's circumstances, I might not be able to give an accurate judgment because I don't know what medications exactly, but these are some of the reasons why that might be the case. It's possible that the medication that your friend brought into the country is not in our formulary, is not within what we use or we can readily get here. Or it could also be because we have better medications here, or one that has lesser side effects. Because when we give medications, as much as possible, we want to give medications that will give lesser side effect and still do the job. So it could be because of that. That's why the doctor here said, stop these ones and start using these ones. But again, of course, we have our we are independent and we can make our choices. So if the patient has decided to go back to using the one from Nigeria, then that's a choice. But again, it's just be watchful of side effect and counteraction. I will definitely advise against going against a doctor's advice because of monitoring and other things that might be open to the doctor that the patient doesn't know. And again, if the patient has a query about the medication, I will probably advise that they speak to the doctor about it rather than going behind them to order for the medication again. And it might actually be causing them harm rather than good.
Thank you so much, Doctor. I've also shared the program to have for her to be listening.
Thank you. Before you go, also, I will actually want you to ask your friend this question. Is it that the medication she went back to was working well for her? Or what was the rationale she decided to go back to the old medication? Like Dr.
That was what she said. She said, that one from Nigeria is good for her, that she can't do without it, something like that. I'm like, why is it that you want to do, why are you doing this to yourself? The doctor in here, I believe they are more professional than those ones, or because of the region, according to what doctor just said.
So I think my advice will be, if the individual is listening, is like, take the medication you think is working for you to the GP and take the one they prescribe here for you to say, this is working well compared to what you prescribe. It could be what Dr. Shinobi said, that maybe we don't have that kind of medication here, and there's something equivalent or even better. Because let me tell you the danger in what the individual is doing. There won't be medical review, which means, so when somebody is on medication here in UK, they will book you to come and see the GP maybe in 3 or 6 months' time. They will do all the physical health check for you. You know, when Dr. Adesala was talking earlier on, he mentioned that majority of people, if you look at majority of people, not all, but few of the people on high blood pressure, some of them have, if not all, diabetic. They have one other physical problem, because we don't know if this individual medication this person is taking is causing damage. They might be treating the high blood pressure now, but causing other damage. And I think it's actually best that if the individual is living here now, they are open with their GP and they tell them exactly what is working for them and see how the GP can support them. Rather than self-medicating, it is dangerous. Thank you so much.
You're welcome. Thank you so much. Thank you, doctor.
Thank you.
Yeah, welcome. Yeah.
So thank you, Dr. Oshinobi, for that one, because to be honest, we have quite a lot of people that do that actually is doing what the last caller said, that they self-medicate a lot. You know, some of them are even taking all these multivitamins that they buy on Forever products. Some of them will bring it from Nigeria and they will say it's working for them, you know, and there are quite a lot of side effects of this medication. So back to what we were saying earlier on. You mentioned alcohol. You talked about smoking.
Yeah.
In terms of causing high blood pressure.
Yeah.
You understand?
Yeah.
So what treatment plan? You know, we have some patients that they will tell you they have capacity to make informed decision. They will tell you they're not stopping, and they're on high blood pressure medication, and they won't stop smoking, and they won't stop drinking. My first question is the 14 units of alcohol. You said it's over the week. In our calculation, because I don't take alcohol, how many bottles is 14 units?
Okay. I literally just showed that. So a pint of beer, a pint of beer, which is about 568 mils. That's what we call a pint of beer. And a pint of beer averagely has about 4% of alcohol. Okay, so that pint of beer that has about 4% of alcohol is equivalent to about 2 units of alcohol.
2 units.
Yeah.
Okay. So we're saying max 7 bottles for the whole week.
Yes.
When some people will go to a party and they will think 10 or 15.
Yeah. Yeah.
Okay. So I think
and again that's based on the alcohol content. So the pint of beer that I've told you now is just 4%. You know, people take what we call ogogoro or ororo that is 40%, or that is more than that. So if it's more than that, then that's going to vary. But the one I've just told you is the typical beer that people typical pint of beer that people easily take, and that has only 4% of alcohol. So that's
we're
different
talking
from
about Courvoisier, champagne, all those, a bit of I don't know, Mate something, you know. So those ones have higher percentage of alcohol.
Yes.
So at the end of the day, we're not recommending 7. You understand?
No.
In a week.
No.
Thank you so much.
So that 7 pints whatsoever is for the alcohol that is just 4%.
Okay. So can we talk about the treatment plan here? Apart from medication, is there any other way of managing high blood pressure?
Again, I think the treatment plan, it's applicable everywhere. So similar to what I mentioned earlier on, your diet modification, exercise, losing weight, avoiding alcohol or cutting down alcohol, avoiding cessation of smoking, avoiding stress, so doing a lot of meditation, going to the gym for exercise, mindfulness, all those things all come together to help with managing your blood pressure, in addition or sometimes substituting medication as well.
Okay, thank you. But when somebody is having like pronounced, like somebody is on the 200 over, 110, so obviously that is actually there will be need for them to then start taking medication quickly. We have some people that when they are pregnant, that's when they get high blood pressure. Why is that? As soon as they deliver the baby, the high blood pressure vanish? Why is that?
Yeah, so usually that's due to the hormones of the pregnancy. And if you remember when I mentioned cortisol, that's the stress hormone. So similarly to that, we have hormones in pregnancy that affects blood pressure. So usually when in the typical way, when you are pregnant, the first and second trimester, your blood pressure is going to be low or normal. Again, that's the way the body works. I don't want to go into the mechanics of that, but typically your blood pressure might be low or normal. And then typically, because of the development of the placenta, when you get to the third trimester, then sometimes you are predisposed to high blood pressure. And it can sometimes be severe and predispose you to what we call preeclampsia, which means that you can have seizures in pregnancy, or you can have so that's a bit of a complication of high blood pressure in pregnancy. But like you mentioned, as soon as they deliver and the placenta is off and all the hormones have corrected themselves, the blood pressure comes down.
Thank you so much. And I think for me, what I picked up here, I don't know for other people, so for the viewers, is actually like stress, because I've got quite a lot of patients that they are actually doing exercise, but they worry too, they worry about almost everything. So I think your explanation is now making sense. Like the cortisol is releasing whatever into their body because they don't really eat. You understand? They watch their weight, they do exercise, and yet they're not losing weight. Rather than they're adding weight. So, but one thing that I can pick up now reflecting is that they have quite a lot of stress factors that a lot of social stress factors that they're dealing with that is actually causing them all
Or
these things
contributing, yeah,
to to
contributing
to
to, yeah.
to actually making them. And I think what I can because I know the individual is online as we speak, because I've told her to join, and then obviously I can ask the question. She's a sharp person, so I know she's listening to me. And I think so. How can people manage their stress to reduce the level of cortisol uh, in their body?
Yeah, that's a very good question. And sometimes it's difficult, really. No matter what you do, unfortunately, those causes of stress you can't get rid of them, whatsoever the cause is. But again, is that whole understanding that the stress is there. Unfortunately, I can't get rid of it, but I can manage it. Is getting support if you need the support. So quite a number of people just want to hold things to themselves. They don't want to appear weak when seeking for help. They feel like if they seek for help, it will make them weak or to make them a failure, uh, which quite which is not right, because the fact that you're reaching out means that you're strong enough to reach out to people. So again, seeking help early enough rather than allowing things to disintegrate or become worse before you seek help. So seeking help early enough will help you to be able to get help from appropriate quarters. Meditation, yoga, some people do yoga, which just is a form of distress, and it just takes your mind away from all those things temporarily, as the case may be, because you know that after that time, whatever is there is still there. But the fact that you can have a moment to yourself when you're not thinking about all those things helps. And again, like I said, I think one of the important thing is seeking help. There's help everywhere, really. It's just you reaching out, and you might be able to get somebody that will signpost you to where you can get help, rather than bottling things up and then it becomes a problem or a burden to you.
Thank you. And just to add to what Dr. Oshinubi said, I do recommend that, because I know a lot of people, if you ask them to go and register in the gym, for people in Nigeria, financial issue could be, to be honest, I never had to go to gym when I was in Nigeria. Anyway, I don't even know, where in my locality where gym is. But for people, you understand, who actually are in Nigeria, there was a time one of my friend actually sent me a video. She didn't go anywhere. She just came in front of her house. And then, do you know what she did? She set up like a wool, like a 4-corner wool. You can't use plastic. It has to be like a proper wool, not like a stick. Then she made like a this shape and set it like put 2 layers on each other. Like when we were growing up, like when you're playing this game, we call Tente, she was literally putting one leg up on the platform, putting one leg back, putting one like you're climbing staircase, and she was going and she was going and she did it for 30 minutes and she did it for 2 months. She was doing it 3 times a week. You don't have to go anywhere. You could stay in wherever there's no way you cannot get something. Even if it's strong, there are some bow that are very strong that you can put. You're not standing on them. You're just climbing, coming down, climbing, coming down. Just to like when you're going on a staircase. If you have a staircase at home, you can make it an exercise. Then I recommend going on YouTube. They're free. Put home workouts. I do it a lot. Because even here in UK, I registered for a gym for months. I didn't attend. And I was just praying that I canceled. Then I'll go on YouTube. When I finish work, when everybody's in bed, I'll go downstairs. I'll go on, just put home workouts. It will bring out a lot of videos that you can do for 15 minutes. You can do it for 30 minutes. There are some for 45 minutes. And you'll see the demonstration. Some actually are targeted for flat tummy. Some are for the whole body. Some are for easing off stress. So go on YouTube and type home workouts. It's so easy now that everybody always have data, at least even if it's 100 naira, 200 naira. You can use it, even if it's one. When you do it one, then you should be able to write the step down and carry on doing it. Or, download it on your phone to be playing it for yourself. I think the whole idea of what we're saying today is you have to make sure you actually add one form of exercise to your daily living. But that's twice a week if you're actually not trying to lose weight, to maintain and keep fit and healthy. Or you're trying to lose weight or control your diet. Then I will take us back to the way we cook our food. Dr. Shinobi, couple of years, I had this company came to my house. I bought a set of pots. It's called Salad Master. So this pot is actually used for, they use the same metal that they use for our teeth when somebody loses their tooth and they want to insert a new one. The same, what do they call it? The aluminum they use is the same one they use for the pots. You can cook without putting palm oil. You can cook without, normally when you use normal pots, it will burn. But this Salad Master is designed that you can cook without using any palm oil or groundnut oil with it. And when they were now showing us how to cook our meal, I think we need to stay focused on the way we cook our vegetable. Majority of our vegetables that we wash, when we wash it away, we've already washed away the nutrients. Some of us still wash this vegetable for shoko with warm water. I grew up and I was introduced to the way you wash and cook that vegetable. You wash it with warm water. As soon as you wash it, you see the water is green. That is the nutrients. Whatever you're cooking, you're eating leaves. Then the way we cook our vegetable, after we've done the sauce, they will cook it for another 20 minutes. Everything is finished already. I think we need to actually pay attention and details to the way we cook our food. Not just the portion of what we eat, to the way we cook our meal. Ensure at least, it might not be tasty the way you want it, but it's healthy. It gives you long life. Look at the way people are having high blood pressure. By the time they make one noise, before you know it, they're having heart attack. They're having, all these things, before you open your clothes. Somebody passed away yesterday. One of these Hollywood great star. I was still watching his film, and I just woke up yesterday morning and I saw this individual, I can't remember his name, has actually passed away. We need to be careful and take our health serious. Not even in this today's day, you understand? And for those of you, healthcare professionals, come closer, working on the ward, that you do 7 to 7 or 9 to 9 shifts. You understand? All you nurses, all you social worker that you work on the ward, that you do 5 long hours shifts. That is in the morning, your breakfast is in McDonald's. Lunchtime, you branch in to your cafe in the same hospital to buy whatever sandwiches and whatever they're selling. And on your way home, because you're tired, you're buying KFC for dinner. You understand? Please, you need to review what you're eating. Like our doctor normally said to us, our food is our medication. Please, I am appealing to every one of us. Let us actually pay details to what we eat. Let's cultivate the habit of not eating late, actually, to start with. If you know the time you come back from work, you can make sure you have your dinner packed, and have it before you leave your office. If you're those people that will be coming from, I've got some uncles that work in Victoria Island. They will spend 3 hours, 2 hours in traffic before they go. And I've told them, make sure you pack your dinner. You understand? You go a driver, eat before you get, or eat in the car, So thank you so much. We've got Uncle Adewodu online saying, well done, Dr. Adetola Oshinubi. Thank you so much, Big Daddy, for joining to support the program. And I want to say a big thank you to all the callers that call in to ask questions. We are rounding up. We've got only 3 minutes if you want to call in and ask any question. For those people who are in abroad, you can call in on WhatsApp. We'll pick up. If you're calling from abroad, from any part of the calling, you can call in on WhatsApp. We'll pick up. I want to say a big thank you to Dr. Adetola Oshinubi, because trust me, he's so busy. I have to be on queue for months to be able to get him to come and say, let's talk about this again. When I see our people, our elderly people, they've labored so hard, and at the end of the day, they're 60, 70, all of them, almost all of them have high blood pressure. And I'm thinking, these people have worked so hard, this is the time for them to relax and be eating the good fruits of their labor. And now, even young people, as far back as the statistics said, 16, 17, 18, we don't want to be seeing our children dealing with high blood pressure. It's not really good. So we want to say, please, let us, and I think for me, you can't go wrong with exercise. That's one thing I tell people. You can't go wrong with exercise. It's never too much, you can never go, even if it's walking. For we, I do it a lot. If I have to go anywhere, I park at a distance and I pay and I walk down to where I'm going. Because obviously we all drive, we barely have time to go. In the night, I'm always using the home workouts, you understand, or go for a run, within my own locality. So I want to say a big thank you to everybody that is online. When we finish the program, we'll read your comments, we'll respond to them and all the callers. And if you want us to treat any other topic, please send in any topic, ask questions. If you don't want to call online because you think people will know your voice, you can send us email on info.yourhealthmatters@yahoo.com, to ask us to treat any topic, or to ask Dr. Adetola Oshinubi. We'll pass your information to him and he probably will respond to you. So till next month, I want to say thank you so much, everyone. Thank you to our guest speaker today. Thank you to all our people online and to our caller. Till then, look after yourself. Make sure you're drinking. The weather is actually cool today. It's actually beautiful. I don't know if it's raining or yes, but it's actually raining currently in my area. Look after your well-being. Look after your physical. Look after your mental state. It's a very small life. You want to live and enjoy yourself, even now and old age. Till then, stay tuned. Bye.
Bye.
Bye.